And we're back, dear viewers, as Helicobacter pylori is a type of bacteria that can live in the lining of the stomach. Infection with Helicobacter pylori is a major cause of peptic ulcers or gastric ulcers and duodenal ulcers and is linked to some stomach cancers. More than half of the world's population is infected with it. So, dear viewers, let us know more about stomach bacteria, its symptoms, causes, and treatment methods through our dear guest, Dr. Ghanem Alsalem, a consultant in internal medicine and gastroenterology. You're most welcome on Good Morning, Doctor.
Thank you very much for having me and hosting me on this show. Good morning to everybody. Good morning to you. Good morning to Kuwait. And I hope that we are enjoying the weather. It's very interesting that you see such much cold now in Kuwait in these days. And I really like cold. We don't like the really hot weather. So it's enjoyable moment, part of the year in Kuwait. And especially recently we have ended the Gulf Cup tournament here in Kuwait, and it was very successful. Seeing all our brothers and sisters from the Gulf area joining here in Kuwait. And Kuwait is the peaceful country hosting most of the sports here in Kuwait to enjoy, and definitely keep warm during these days.
True. Thank you, Doctor, for your warm greetings to our dear viewers. And also, it's such a pleasure to have you again on this show to explain to our dear viewers more about medicine and
exactly. That's our aim, to spread knowledge, medical knowledge through the population of Kuwait. Thank you for the Ministry of Information. Thank you to you. Thanks to the program, to the director, whoever is involving in spreading the medical knowledge through the proper channels, and that's what we need to make more people educated about their health, educated about the right information. As you know now, the social media is full of information. Some of them is good, some of them are bad, and we always advise the population, people, to get the information, especially the medical part, from the real and reliable sources of information, because you can get wrong information from other media or from other people, and that will really have a very negative impact on your health.
That's true, Doctor. Thank you for clearing it out for our dear viewers. So, Doctor, what is stomach bacteria and what causes this disease?
Yeah, so this question is general. Bacteria can infect the gastroenterology or gastric tract of the human from mouth to anus all the way. But we will focus on the stomach part, where the stomach, as you know, most people will say it's acidic environment. How come bacteria can live into it? So yes, it does. Some of the bacteria can live in the stomach and can cause harm. And these bacteria are special. They have special mechanism to protect themselves from the acid environment in the stomach. And one of the most important one is the H pylori, as your report was mentioning, the H pylori infection, which is, I like the terminology, the Helicobacter bacteria, because most people don't understand what's Helicobacter bacteria, and that's our job to explain what's Helicobacter, and you'll see this a lot. I get this question from everybody, Duania in work, you know, when you go, anybody knows that you are a gastroenterologist will say, oh, doctor, I want to ask you about this germ or this bacteria in the stomach. So the H pylori, the Helicobacter bacteria, is an infection get inside your stomach, and then the bacteria can have this mechanism of surviving in the wall of the stomach inside, and then start to cause problem to some of the patients. The bacteria is itself, we call it gram-negative bacteria. That's a special bacteria. It has a special wall, and it is, let's say, it's not very common to see it in some part of the world, but it is common in the Western societies or the modern societies. Recently we see it here in the Gulf or in the Middle East.
That's great to know, Doctor. So much to learn about bacteria in the stomach.
Sure.
So what are the symptoms of this bacteria, and what are the risk factors for getting an infection?
Yeah, sure. So the symptoms is very ranged. Sometimes the patient don't have symptoms, by the way, and they do the investigation for the H pylori for other causes. For example, if the patient is wanting to start on aspirin for a long time, or a patient is going to have some kind of painkillers for a long time, or they may have steroids for a long time, they do screening program for them to look for the H pylori. So the patient doesn't have symptoms, and then suddenly the doctor will tell the patient, listen, you have a bacteria, you need to be treated. So sometimes no symptoms, Majority of the patients will present with dyspepsia. That's, they feel indigestion. They eat and they feel, doctor, I eat, but I feel full. I cannot digest my food very well, not like before. I feel the food stays in my stomach for a longer time. Some patients may have abdominal pain or their tummy pain. The pain comes and goes. Depends on if they eat specific food or sometimes with any kind of food. Some patients may present actually with complications of the bacteria infection or the H pylori infection, and these are with the patients where we actually pay attention more to them because the complications are really serious and dangerous. Sometimes the patient may have ulcers, may have bleeding inside. They don't know they have a bleeding inside, and we'll tell the symptoms of the bleeding with the warning signs. And sometimes they may actually have cancer. 5% of the patients with H pylori infection, they come present with gastric cancer. So these are the main things with symptoms of the bacteria. Some patients, they actually just do a routine blood investigation. They are healthy people, they have nothing, but they do investigate themselves from time to time, every year or every 6 months, and then they find they have anemia, where they have iron deficiency, and that will cause one of the reasons for the H pylori infection to cause anemia. But let me tell the audience, and I want them to focus on the alarming signs of the H pylori infection, where the complication is the ulcers and the bleeding. If they vomit blood, or if they see black stool in their, and when they go to the toilet, these are the two signs. Or they have pain, severe in the abdomen or the tummy, and they cannot go, and the pain lasts long. These are the 3 signs or symptoms. If they have to present themselves to the emergency department or to their doctor to look for the H pylori and treat it very well.
That's great to know, doctor. So once, our dear viewers, once you identify that there is any kind of pain in your stomach, you need to seek medical help and that. And therefore, stomach bacteria, when diagnosed, how advanced are we in this modern age to treat it?
Oh, that's a very good question. We are really in advance in treating the H pylori.
Sorry.
H pylori, or the Helicobacter bacteria, is a living organism, needs to be killed, needs to be eradicated from the stomach. So we follow a protocol. It's proven scientifically that there is what we call quadra treatment. We use 4 medications to treat the H pylori. It's not easy to treat the H pylori, so if you have it, you're really gonna go through the course of treatment, which lasts maybe 2 weeks or more.
But is it curable?
It's curable. 10% of the population, they may not get cured because they have the superbug, let's say, the bacteria where it resists all the antibiotics we have. But the 90% of the population will be treated and cured, and they will that doesn't mean they have immunity from it later on. They may get infected again. But we treat the bacteria, we have to treat the bacteria to prevent the complications of that bacteria. So we use antibiotics, and we use what we call proton pump inhibitors, where we reduce the acid production inside the stomach with the help of the antibiotics. And we tell the patients to follow some healthy lifestyle. We advise them not to eat from outside food, or the food is not clean, or they are not sure about the the hygiene.
Depends where you eat, doctor.
Of course, of course.
So, doctor, so regarding treatment, we know that there are some herbal medicine and some natural medicine. What's the best way to treat this disease?
I'm glad you brought this up, because this is very important for the audience to understand. I'm not against herbal or any alternative medicine if you want to use. But you have to understand this bacteria is a living organism and needs to be eradicated, needs to be killed. And the only proven way scientifically, and with all the evidence about it, all the trials or the experiments done, it's with the antibiotic. So you can use the herbal medicine as add-on therapy. Discuss this with your doctor. The doctor will be happy to discuss this with you. They will tell you this is good, this is bad. And sometimes patients refuse to take the antibiotics and take alternative medicine. And this is where the problem, for the patient, they will cause harm to themselves. The bacteria will not go, and they will still have the symptoms. The bacteria may reduce in the number of the bacteria production during when they are on the herbal medicine, alternative medicine, but the bacteria itself is still there in the stomach, doesn't go away. So they need to understand the antibiotics is made for this bacteria, and not all the antibiotics are good for the bacteria. A specific antibiotics is being done to treat this specific bacteria. So use the herbal medicine if you want. Use the alternative medicine. If you go to the clinic, my clinic, you will see a lot of patients come with strange prescriptions, or whatever you want to call them, and they are very doesn't make sense to me anyway. But maybe they make sense to them, or make sense to other people. I'm not against them, but I don't encourage them. And still, I always advise our patients, and I advise now our viewers to discuss this with your doctor freely. Open your mind, open your heart to the doctor, and the doctor will be happy to answer you.
So, doctor, how as patients or as normal people, how can we identify the early symptoms of this bacteria instead of just finding blood?
Yes, sure. So when you have this strange feeling in your stomach, you know yourself. Everybody knows themselves. I always say that you are better than the doctor in diagnosing yourself. So if you feel that the way you eat food is changed,
yes,
the pain is coming, changed, or you don't have to live in agony and say this is only because of the cold or because of that. Go present yourself to the doctor. The doctor will examine you and make the right diagnosis.
Yes.
Let me tell you that now in Kuwait, alhamdulillah, we are really happy, thanks to God, that we have this very good health system. We have the polyclinic, the mustawsif is there, the hospital is available, and it's easy access to most of the doctors. So you can present yourself with any kind of symptoms where you feel dyspepsia, indigestion, or you feel that you have burping a lot, yes, or you have some kind of pain wakes you up from sleep, or the pain is associated with the food. These are you feel tired sometimes. These are the things where you really need to present to your doctor, and maybe the early signs of the infection with the H pylori, and then you can get it on, treat it, and live your life happily.
Yes, doctor. So as we know from our questions, stomach bacteria, is it contagious? And why is it called a silent killer?
Okay.
Or silent danger? Does it really come down to cancer?
Yes.
God forbid.
Yes.
How much of a percentage, if somebody has stomach bacteria,
yes,
would get cancer?
Exactly. That's a good question. 5% of the patients with the H pylori, studies showed that 5% of the patients may develop what we call gastric stomach. And the gastric stomach in this kind of bacteria, it's treatable, so we can detect it early. And you have to understand that the bacteria sometimes has no symptoms, and it is sometimes silent and it's hidden. Regarding the contagious part, it is nothing to prove that it's contagious within the family or within if you share the food with people. But it is contagious during the preparation of food when the person who's preparing the food is having dirty hands. So the main way for the bacteria to go from person to person is through our hands, infection, if the hand is preparing the food was not clean. So that's why we always encourage our patients, our friends, our families, everybody and the audience to make sure that they get the food from healthy and clean places. Yes. Where if you go for let's say exposed places or restaurants where they are not really going through the proper cleaning part of the food or yes, preparing the process of the food, then bacteria may spread yes, in the society or the community.
That's true, doctor. Also here in Kuwait, mashallah, 90% of our restaurants, or 95%, are certified
yes,
by
yes,
authorities
sure,
that they have cleanliness food.
Let me emphasize on this part. Here in Kuwait, we have really the good authority on restaurants. Yes. And the government always makes sure that we don't. Let me give you the evidence. We don't have outbreak of food poison here in Kuwait, alhamdulillah. It's yes, maybe happened in the past, maybe once or twice, but it's not common. And most of the restaurants are really being monitored and closely observed through the authorities. So that's why here in Kuwait we are kind of safe relatively to the other parts of the world. But the Kuwaiti people, and most of the people live in Kuwait, they travel a lot. And we like to travel a lot. And we like the street food. And we like to eat from, restaurants sometimes where it's not really, managed well, let's say. So always make sure that you eat the right way.
That's beautiful to know. Thank you so much, Doctor, for your information. Dr. Ghanem Alsalem, dear viewers, we would like to thank him so much for his insights and experience on foods and different kinds of foods. And don't worry, dear viewers, if you want to go eat anywhere, because Dr. Ghanem Alsalem is here to treat us. Thank you so much.
Thank you for having me. Thank you very much.
Thank you so much. So, dear viewers, now we'll take a quick break and we'll be back. Stay tuned.